Hi, and good day. Herniated discs, bulging discs, is a huge epidemic not only in our country but worldwide. Millions of people have these herniated damaged discs, and there are many of these people who don't even know it. But these conditions can really turn our life upside down. It affects us emotionally, it affects us physically, where we're incapable of doing many things again. It affects us sexually. Herniated discs are treated in many ways, although the first line of defense is medication. Medication will help relieve pain, take away inflammation, and reduce muscle spasm, but it will not correct our herniated discs. The two main reasons of getting these particular pathologies is from poor posture and from acute injury. Lifting incorrectly, chronically doing things incorrectly over the course of time causes a lot of wear and tear and stress in the ligaments, muscles, and discs. Poor posture, a forward head posture, bringing your head forward, being in an awkward position with your shoulders rounded over prolonged periods of time, called cumulative trauma disorder, weakens the ligaments and obviously will affect the discs and the tissues as well. The first line of defense with this underlying pathology of disc herniations or bulging is preventing what originally caused it. So looking back at the things you do day after day, your type of occupation, the type of work you do, or even the type of athletic sport that you participate in, these are the things that you have to reframe and or change or correct or modify to prevent these problems from worsening. If you continue to pursue what initially caused your condition, the condition is not going to go away. It will only worsen within time. In the neck region or the cervical area, herniated discs are most commonly caused by forward head posture. This type of instability causes excessive stress in the neck and shoulder area. Our head weighs approximately 12 pounds. For every inch you go forward, it adds an extra 10 pounds. So just 3 inches forward is 42 pounds of extra stress that your back of the muscles of the neck are holding up on a regular basis, day after day. So you need to correct the particular muscles, the rhomboid muscles, by strengthening the rhomboid muscles and stretching the pec muscles. That would help this particular condition tremendously. The other important thing is correcting the mind, changing the way the mind thinks. That by retraining the mind, by retraining the brain, you are actually trying to fulfill a habitual change that over 21 days, by consistently being aware of your forward head posture, making sure that the ears are in line with your shoulders, and you continue to strengthen the rhomboid muscles, stretch the pec muscles, and over the course of time, your brain will understand where your head is supposed to be at all times. And it will automatically correct on its own rather than you trying to correct it manually each time. In reference to the lower back, most commonly seen L5S1, L4, L5 herniated discs, most commonly seen from incorrect lifting, a cumulative trauma disorder of lifting incorrectly, sitting incorrectly, particularly with the incorrect chair, doing that over prolonged periods of time, excessive weight, having a belly that you're putting too much stress in the belly where the back has to overload to compensate for that extra weight, and very weak core muscles. So in this condition, you need to get up more often from where you're sitting. You need to strengthen the erector spinae musculature as well as the core muscles. That will help stabilize and take away a lot of the stress off the lower back and the disc. Again, if you just continue to do what you're doing and just get therapy and treatment without strengthening the core, changing your ergonomics, and changing the muscle integrity of the overload, this will continue to linger on and give you more complications in the future. In reference to your disc condition, physical therapy, physiotherapy is beneficial. Electrical stimulation, ultrasound, mechanical traction, decompression therapy for the neck and lower back region is very helpful, but that's just a piece of the pie. When it comes down to active therapies, these are the exercises you must do to strengthen those weakened muscles, particularly core for the lower back, erector spinae musculature for the lower back for stabilization. Just not abdominal exercises because that's not going to work the deep abdominal muscles. So the core exercises like planks and other exercises like that is very helpful, particularly to the neck area, strengthening the rhomboid muscles, which are the main retractors to help bring the shoulders back, as well as stretching the pecs. The other one is posterior translational exercises. That's just tucking the chin in and bringing it back. From the side, you can see this position, not this, but this position, to strengthen those posterior muscles of the neck as well as the anterior muscles. But again, retraining these muscles are important because no therapist can do this for you. This is something that you must do. Last but not least is nutrition. You are what you eat. If you don't put the right material, vitamins, minerals, nutrients inside your body, you're not going to have it available to heal. Your body does not produce many of these vitamins, many of these nutrients. It cannot heal without them. It will break down. It will continue to put you into a chronic phase of pain, inflammation, and deterioration, along with what we call degeneration. So make sure you're getting the right nutrients, vitamins, minerals, not eating all those fried foods, all those processed foods where you have no nutrients in there. Make sure you're getting your whole grains. Very, very, very important. But the most important vitamin that you can put in your body is vitamin C. I recommend a time-release vitamin. You can get 500 or 1,000 milligrams. There are different types of vitamin C's, but for your purpose right now, understand that vitamin C helps produce collagen and elastin. Collagen and elastin are in all parts of the body, the muscles, the ligaments, the tendons, as well as the discs. This helps repair. This is what keeps the body functioning and healing correctly. So vitamin C is extremely important, and keep that in your diet, because if you're not, your body's not producing it and you may become deficient. And that can actually be a tremendous asset when it comes to healing. So regarding your herniated and bulging discs, remember the body is always in a state of healing. It's trying to heal, but if it can't, there is a reason why. You need to look at the whole picture. Your type of work, the things you're doing that produced it, the type of therapy to help reduce the inflammation and accelerate the healing, your own self-awareness of the things that you do every day, particularly if you are overweight, something that you want to make sure you're losing the weight, building the core, increasing the strengthening exercises. Supplementation is very important, as we discussed, and I believe that you can make your way through this type of pain and make your way to recovery over the course of time. Make it a great day. I'm Dr. Alan Mandell.